from the beginning, is tattoo removal. Is a presentation which we're quite proud of, because it gives you a lot of insight on tattoo removal. And this presentation is made in order for you to educate, for yourself to be educated about what you can do with tattoos. In here, we don't know where this picture was taken from. It's not our picture, by the way, but you can see some fading of the tattoos. This is called ghosting. Now, the point we're trying to make with this picture is that most cases you're able to fade tattoos but not remove them completely without leaving any trace as advertised. As we will see, in most cases, I should say, complete removal is not feasible without leaving some sort of scars or some sort of permanent skin texture modification. But we have new more results coming out, so we're going to talk about more case studies on tattoo removal later on. Now, when we're talking about tattoo removal, the thing that we really think about is laser tattoo removal. Laser tattoo removal works on the fact that whenever you are actually hitting the tattoo with light, over time the tattoo will fade, the ink will be absorbed in one way or another. And this is just an example of it, how the tattoo can change over time just because of the sheer time that is passing. The more exposure you get into the sun, the more the tattoo is going to fade over time. And this is what happens with tattoo removal using laser. So you're hitting them with light and so on, and then it fades over time and during a number of treatments. Now, remember that tattoos are quite difficult to fade or to remove because they're made to last. Tattoos normally reside inside the dermis and not just on the epidermis there. So, and since they're on the dermis, then it's going to be quite difficult to remove them in most cases. And there's many different techniques to remove lasers, and the best known ones is lasers, and this is the frosting after a laser blast. So it's laser tattoo fading, and there's also plasma, which is the technique that we teach you by using electrical arcing. But another way of which is I am absolutely an advocate of is the surgical excision, because in surgical excision for very small tattoos, what you're able to do, although you get a scar, but mind you, this is a fresh scar, what you're able to do is just remove the tattoo within one session, and then you can deal with the scar later on. Whereas if you're doing a plasma tattoo removal or laser tattoo removal and so on, then you have to go through a number of sessions in order to achieve the same results. So, and also every time you do a tattoo removal treatment, then what happens is the skin suffers, you get blistering, you get risks of infections and so on. So if you have a small tattoo where there's a lot of loose skin, then it may be a good idea to do a nice surgery and remove them once and for all, and then you deal with the scar later on. This is something that was introduced by a surgeon, a plastic surgeon. He said, well, I normally cut the tattoos, it's so easy. And I agree. And this is a before and after using salation, which is just using salt on its own, and it's quite a good way to fade tattoos. There's always a bit of ghosting after, but well, it's better a bit of ghosting, that if you don't want to have a tattoo, then it's a good idea to try this particular method. Then you can use microdermabrasion. You can use chemical peels. TCA has been advertised for a long while for tattoo removal, and it's got some good degree of success. It can cause scarring like any treatment, and some people talk badly about chemical peels for tattoo removal because they're effective and cheap. So obviously there's a bit of a problem there for cosmetic clinics. There's also cryotherapy. You can use IPL. Cryotherapy is not particularly a good idea because it doesn't really work effectively, but some people have tried it. IPL is using light again, broad spectrum light, in order to fade them. This is a picture that we put in there just to give you an idea of what happens for most tattoos in reality. For most tattoos in reality, say for example, if you don't want to have this image there, you go for a tattoo removal session or a few, so they're a bit faded, and then you cover them up. We've seen so many cover-up tattoos is incredible, and the reason is because they are the most feasible way to go about them. So basically, you have a tattoo you don't like, you realize that there's no way that you can remove them completely seamlessly, and then you give in and you say, hey, okay, it's good enough for me to cover it up, and hopefully people will not actually see it, and I will not see it. So, and then you cover it up. So tattoos is something that I'm not a great fan of because of this problem. You may like it when you have it done, and then all of a sudden you think it's rubbish. So there's adverse reactions to different types of treatments. Some of them are permanent, like the scarring or hypopigmentation or change in texture, and the other ones are going to pass, are going to only momentary, only going to last for some time. So some of them are blistering, especially that happens all the time with laser tattoo removal, which you're going to see shortly. There's immediate redness and swelling. There's minor bleeding, frosting for laser tattoo removal, discomfort and pain during the treatment, itching during the healing progression, swelling and infections, which can happen. Swelling and blistering, blistering always happens after tattoo removal. This is the way the frosting immediately during the tattoo removal. And why we suspect one of the reasons for laser tattoo removal to be so used is also for this visual effect. When you actually blast a tattoo using a laser, it seems as if you're actually deleting it, which is a really a non-permanent thing. It's something that doesn't actually last long. It's the effect is going to go really, really quickly. So, but it's a good visual effect, so people say, okay, that's nice. But then after the healing is over, then you find that it's just faded by a little. But as you do it, immediately you get it actually looks as if you're deleting it, but it's actually not a true delete. There's the frosting effect, and that makes the tattoo appearing as if you have actually almost removed it, which is not the case. There's the redness that you get immediately after the laser treatment. There's some minor bleeding, but this happens, some minor bleeding that can happen or may not happen, it really depends. And this happens all the time. The blistering, something that people never tell you about laser tattoo removal. They always occur, so, and you cannot avoid it. You cannot avoid it. And this is the what happens after plasma tattoo removal. You get the scabs, and then you get a bit of itching as well. Make sure that the scab falls off on its own accord. Don't use water or anything on the area as long as you have the scab. This is an infection of a tattoo, and then you have the undesired effects of changing skin texture, some eye scarring, and then hypo or hyperpigmentation. You can get all sorts of results after tattoo removal. Hyperpigmentation is one of the most known side effects, undesired effects to laser tattoo removal. But mind you, we haven't seen one case so far of tattoo being removed using a laser that doesn't have some ghosting effect or anything or something. So conclusions are, tattoos are not easy to be removed. In our view, they should be called tattoo fading. Treatments other than surgery, which is the only and true tattoo removal procedure, because you remove the tattoo immediately, whenever possible, because it's not always possible. And you find more information on voltaicplasma.com. And this is the end of this particular yes, we've got more people here. Actually, yes, one extra person is Medsalon Spallon, I think. Yes, any questions? Any questions? Yeah.
I didn't have a question about tattoo removal, but I will give you this question. What is the difference between with plasma when you do different types of skin? Where is the best results, on dry skin, or what is your practice?
I mean, the good thing about plasma or electrical arcing is that you can use it on all skin types, from 1 till 6. And we've treated maybe not thousands of people, but in the several hundreds now. And we treated all sorts of skin types, dry, not dry, old, young. Pretty much no much difference.
Okay.
I think the best, you get very good results on the upper and lower eyelids. That's where you get best results.
Mm-hmm.
But in terms of skin types,
Mm-hmm.
pretty much you get good localized results on the lower and upper eyelids. But some people have a very delicate type of skin, so they may react a bit more not in a nice way. Rare cases, they tend to swell a lot and quite quickly. Some other people don't swell as much. Some people heal quicker than others. But it's a hit and miss. It's very difficult to predict up until you actually do the treatment. Yes. Any questions? Oh, beautiful. I've got a voice behind this nice picture.
Yes, how are you?
Very good, very good. So can you see me okay?
Yes, sir, I can.
Good. So any questions for me?
No, sir.
Okay. Okay, that's fine. If you so where are you based? You're based in the US?
Yes, we're in the U.S., the Dallas area.
Oh, Dallas. Yes.
Dallas Cowboys.
Oh, yes, and the shootings. Yeah. I was in Dallas. I didn't take my bulletproof vest. When I'm gonna go go to Dallas again, I'm gonna get my bulletproof vest just in case.
Oh my.
So, what device do you have?
I'm sorry, what advice do I have?
Yes.
No advice, just listening, interested in the course and the fibroblast plasma course. That's it.
So you have a device, yes?
Yes, sir.
Yes, and is the fibroblast you said?
Yes.
Yes, how much was it?
It was only like $249.
$249.
Yes.
Oh, you
$249.
Oh, you bought it on the internet?
Yes.
Okay. Yes, that's pretty much all. So you're actually looking for to be trained on this sort of devices. Is that correct? Yes.
Yes.
Good. Good. No, that's fine. Okay, we'll carry on with them. If you have any questions, by all means, please ask us any questions you like. Okay.
Okay.
Yeah, and then you can add us on WhatsApp and so on, and ask us questions that way. So we'll go with the very last presentation here.